Welcome and thank you for standing by. At this time, all participants are in a listen-only mode. Today's webinar is being recorded and the recording will be posted publicly. If you have any objections, you may disconnect at this time. Now I'd like to turn the call over to Ms. Erlene Dowell. Erlene, you may begin.
Thank you, Greg Hewitt from the U.S. Census Bureau for hosting our webinar. Good afternoon, everyone, and thank you for joining us for our March LED webinar. Before I introduce our presenter, I am thrilled to invite all of you to the 2022 Local Employment Dynamics Partnership Virtual Workshop on April 5th through the 7th. This year's theme is Making Sense of Data in a New Era. We will be highlighting the work of our state labor market information partners and other data users through plenary sessions, and our keynote speaker is 2021 Nobel Memorial Prize for Economics co-recipient David Card. Please visit our website at lehd.ces.census.gov for more information, and I'll be sure to put the link for registration in the chat. On behalf of the U.S. Census Bureau and the Local Employment Dynamics Partnership, in collaboration with the Council for Community and Economic Research and the Labor Market Information Institute, it is my pleasure to introduce a past LED workshop presenter, Corina Graif, who will be presenting Spatial Network Links to Maternal and Child Health, New Insight for Linking Census Data with Vital Record Statistics. In her presentation, Corina examines how commuting ties are associated with neighborhood, maternal, and child health problems by using the U.S. Census Bureau's Longitudinal Employer Household Dynamics Origin Destination Employment Statistics, or commonly known as the LODES dataset. Graif's research investigates how neighborhoods affect many health risk behaviors and outcomes, such as poverty effects, mental health, or victimization. Corina Graif studies spatial stratification, mobility, and neighborhood effects on health risk and crime. Her work focuses specifically on health of children and youth and on the spatial and network stratifications of health risk behavior, violence exposures, social capital, and opportunity. Throughout her work, she integrates micro and macro level approaches to theory, applies experimental and counterfactual techniques to understand causal links, and combines spatial and network analyses with computational big data analytics. Her work has been published in many journals and has received a myriad of awards. Dr. Graif is an associate professor in the Department of Sociology and Criminology and a research associate in the Population Research Institute at Pennsylvania State University. She received a PhD in sociology from Harvard University and was a Robert Wood Johnson Health and Society Scholar at the University of Michigan, Ann Arbor. With that, I welcome Corina Graif.
Thank you, Arlene. Please signal to me if you can't hear me. My audio may be going on and off. But thank you so much for your invitation. I am very grateful to be back speaking to the census team who has put together such incredible data that I will be working on highlighting today. I am honored to be in an incredible company when it comes to previous and future presenters. This talk aims to be a broad overview of the larger research agenda that uses LHD and LODES data in combination with a variety of other data sets and linkages. And we'll be focusing in particular on a more recent project on infant health, maternal and child health. But I will be trying to provide a bigger picture as well in the interest of inspiring the audience, hopefully, in continuing this research and continuing to make best use of this incredible data that we really I don't think we have much of a precedent for. So I want to acknowledge my awesome collaborators. Megan Evans is a doctoral student at Penn State University. She will be a colleague, no doubt, soon. She'll be on the market. So this is a bit of a practice for her as well. She is available for Q&A as well. And then also Stephan Mathews, who's a professor of sociology and demography at Pennsylvania State University. The larger project includes collaborators like Chris Cero and Joe Reese and Brittany Freeling and Claire Kelling, many of whom are current students, and some of them are already going on their way in the academic world, doing their own research. So thank you again for participating. This is also, let me see if I can figure out how to navigate through the slides. Is it working? It's working. This work has been funded by the National Institutes of Health and the National Science Foundation. And also we are grateful for the tremendous feedback we got on early versions of this research back before the pandemic started, when we were able to be in person. And I can't wait to have another in-person meeting with the folks that we got to talk 2019. So the broader research agenda is guided by a big interest for me personally in neighborhood effects on health. I grew up in Romania and I moved to the United States as a young adult, and I couldn't help but noticing the huge disparities across neighborhoods in the chances and opportunities and risk exposures that people have gotten depending on the neighborhoods they were born into or raised into. Of course, neighborhoods in this country are related to school quality, which of course makes plays an important role in future outcomes. But education is also very much tangled with health, and thus a good chunk of my interest in the neighborhood effects is focused on health outcomes and also health determinants of neighborhood mobility. So a piece of the presentation will be focusing on the broader agenda, and a piece will be focusing on the Spatial Networks project in connection to infant health.
Corina, I'm
Yes?
sorry to interrupt you. The slides, they're still not in presenter mode, and it's everyone is having difficulty seeing the slides, the full slides.
I am seeing the slides quite well, but let me see.
Greg, can you instruct her?
Corina, right next to your mouse, it says display settings right over on the, right above there. That looks good right there. We can keep it at that.
That's perfect. Thank you. So sorry. No? Yes. Yes, now we can see it.
I didn't do anything, but maybe I did. So as long as everyone can see this, I am happy. If you haven't seen the slides, well, let me see if I can navigate. Yeah, I can. Okay. So far, that's the outline. Hopefully this is visible and clear now. Thanks, Arlene, for the
perfect. Yes, thank you.
And then, okay, so the background regarding neighborhood effects that I will be focusing on is we have known for a long time that neighborhoods must matter, especially neighborhood poverty has been shown to be related to aggression, cognitive functioning, physical health, mental health, victimization, risk-taking. We've had incredible studies like the Moving to Opportunity experiment. Many of you may be familiar with that. Was funded by the Congress, and it had a randomized component and which was important in taking care of some of the endogeneity and issues with residential selection. Even a study like that, as well, while over the long run, the effects of the neighborhoods, neighborhood poverty, or moving from poor neighborhoods to affluent neighborhoods, has been found to be contributing to positive outcomes for youth. In the shorter run, there were some really intriguing and puzzling and upsetting effects that we struggled for a long time. I was actually during in graduate school as these findings were coming out, and as sociologists, we had lots of hypotheses as to why a poor family moving from a poor neighborhood to a more affluent neighborhood may not be benefiting, at least not right away. And it is the case that especially boys moving into more affluent neighborhoods became more involved in delinquency and risk-taking. So one of my curiosity turned into a dissertation project and finding out what's happening and why that might be. It turned out that in a study like that, and most studies by necessity, neighborhoods are defined. They have to be defined in some way, and the definition of choice, which was a good definition considering the knowledge we had at the time, was to pick census tracts. Census tracts are geographic units that are maybe between 1,000, 4,000 individual residents. But of course, choosing the geographic scale is always a challenge in understanding neighborhood effects. And that was one of my suspicions, that perhaps if we move the scale up and down, maybe we get more of an understanding about what's moving these boys to contribute, to become involved in more delinquency over the short run. So just to give everyone a sense of, what geographic scale and what geographic distribution of resources, opportunities, and risk it look like in a city like Chicago. This is Chicago, and the geographic areas here are community areas. They have names, they have a history behind them. They're much larger than census tracts. But even when you zoom out, you still see a huge geographic clustering of disadvantage and affluence. In this particular map, we see that geographic areas with darker colors have some of the worst health outcomes. If you guys are familiar with Chicago, you would recognize that some of the neighborhoods with high disadvantage with regard to health, they're also very highly disadvantaged with regard to socioeconomic status, education, and also have some of the higher crime levels. Chicago is a highly segregated city, so moving to opportunity because of that was by design covered multiple cities, not just Chicago, but also New York and Los Angeles. So with the expectation that things may be different from a city to another. Still, understanding the spatial segregation is quite important, and taking neighborhoods as being independent of each other, you don't have to look at too many maps to see that would be a problem, because typically our models, standard regression models assume independent observations, and any map like this at any geographic granularity that you would pick, you'd see huge chunks of poverty clustered together. So what could we do about this? Of course, one of the solutions is to see to what extent you can model neighborhoods as interdependent as they are. And of course, interdependencies may be based on lots of things. One of them is based on how people move across space. This is a map of the same neighborhood, the same Chicago neighborhoods, community areas, but clustered together based on not spatial proximity, but instead based on commuting. And this is where LHD and LODES data comes into focus, and it starts to become very obvious that these neighborhoods, they're not even close to independent as our typical regression models assume. So given that, now that we see this, what can we do about it? Some of the research that I will be presenting today has been trying to get at these issues, at this interdependence, either by adjusting it away or by really modeling it explicitly. So now we know independence is a problematic assumption. Of course, selection into neighborhoods is also one of the biggest assumptions, one of the biggest issues in assessing neighborhood effects, because if people have unmeasured motivations or abilities that make them move to a particular neighborhood, and also affects their outcomes, then a connection between the neighborhood feature and that outcome may be spurious if we don't adjust for those selection factors. But adjusting for those can be a challenge because oftentimes those factors are very hard to measure. A randomized experiment, a randomized design, is a really powerful design in taking away the problem of selection, and the moving to opportunity has done that. Of course, there's other issues in terms of when we think about interdependence of these neighborhoods, they're not just a problem, a statistical problem. They're really a substantive problem. To the extent that we think of neighborhood effects as substantively interesting and important, we want to understand what is specifically about a neighborhood. Is it its poverty, but what specifically about that poverty? To what extent poverty affects social capital of the people in the community? To what extent there's maybe pollution or more jobs in the neighborhood that may affect the constellation of risk factors, and also opportunities that may be contributing to individuals' health outcomes. So considering that, all these challenges that are the standard neighborhood effect studies need to be taken with a grain of salt. They're very important, but we definitely have a ton of work to do in moving beyond the measurement of neighborhood processes and neighborhood mechanisms, neighborhood effects, as if we're just talking about residential neighborhood. We definitely need to take into account exposures to where people go for school or for work or anywhere people travel, especially when they do so on a daily basis. And I think given, the pandemic we're living through these days, that's perhaps an easy connection to make. We now know that we are going to be exposed to COVID, not just in our neighborhood of residence, but we would be very much exposed to that at work, during grocery shopping and church. I think in a way, pandemic has highlighted the pain of this connection, whereas in the past I was thinking about these connections as important opportunities for resources to be transferred from the more affluent areas of the city into the more disadvantaged areas of the city. The COVID pandemic has highlighted very painfully how health risks, but generally also behavioral influence, can be operating across space above and beyond residential boundaries. So as I just mentioned, we've seen that health problems are clustered across space, and that's not just the case when you take a slice in time, but also it's the case when we look at how things change over time. And I guess one of the studies I worked on during graduate school was related to how moving this is based on the moving to opportunity, and I was looking really not even at the network exposures, but at the broader spatial context of the particular neighborhood as it was measured in the original study. And as you can see on the figure here on the left, the families were in the control neighborhoods had a particular exposure to residential employment, and then those who were incentivized to move to more affluent neighborhoods, the MTO group, became exposed to a residential context where more people were employed, and that was a significant difference. So that was expected. That was really by design, and by hope for sure. If you expand the focus to see not just how the immediate neighborhood, the census tract looks, but you show the extent to which the outside nearby areas make a difference, you will also see an additional improvement in exposure to residential employment, to neighbors who are employed. So this part of this first graph has really been missed in prior analysis until recently, because for the reasons I mentioned earlier. There's another puzzle to this. They might explain the negative effects, unexpected effects on voice delinquency, which is, if you look at residential employment, you see improvements with mobility, but if you look at exposure to actual jobs, the group that moved to more affluent neighborhoods didn't actually have more exposure to local jobs, and that was the case. In fact, they had exposure to marginally fewer local jobs. And if you think of high poverty residents, families, local jobs are going to be more important for them than jobs that are far away because of constraints with regard to accessing cars and transportation, commuting long distances. And that was the case not just when you're looking at the immediate neighborhood, but again, when you're looking at the extended neighborhood. So once again, back to the original map showing the spatial clustering, whereas the spatial clustering has been adjusted for in some of the more recent advancements of spatial models and neighborhood effects, this additional dimension of exposure to risks and opportunities in the neighborhood of workplace or the neighborhood of activity, just routine activities like going for grocery shopping and church and school. This hasn't been explored that much yet. So this is where my research comes in. Excuse me for a second. Forgot to bring my water. All right, so when we think about neighborhood effects, we have obviously the challenge of understanding to what extent what we're seeing is a real connection, is a simple correlation that may be spurious, maybe due to selection, and is it a true effect? Some of the work that I've done so far has looked at, I guess I already mentioned a study where I expanded the view of neighborhood exposure to include the outside neighborhoods, the extended neighborhoods, and that proved to be quite useful in explaining the local poverty effects on voice delinquency. So building on that, the findings, I got encouraged in the sense that it seemed like there was a clear there were clear additional processes that hadn't been taken into account in prior work, and then I expanded to look at residential, not just residential neighborhoods, but beyond residential neighborhoods, looking at commuting neighborhoods. So and when I did so, disadvantage exposure in people's neighborhoods of workplace seem to be significantly related to local levels of violence and property crime, as well as domestic and sexual violence. And these projects have been published, some of them quite recently, in Justice Quarterly Journal of Quantitative Criminology. And also there's a very recent study now forthcoming in demography where we're showing with Megan here and also another fantastic student, Laura Newmeyer, showing that exposure in neighborhoods of commuting, of workplace location, exposure to infectious diseases is related to local STI levels. A very recent in the oven type of study right now under review, actually with the revised submit, is showing that exposure to local to network commuting network local COVID, so the COVID cases and death rates in the neighborhoods where people go to work is very related, significantly related over time with increases in local COVID cases and deaths. Now, beyond the focus on neighborhood effects, we still need to go, a lot of these studies don't have the careful design, the randomized design. It's way too expensive. It probably must have been millions that were invested in a study like the Moving to Opportunity Demonstration Program. And when we don't have that, we have to rely on the data that we can put together and then looking at understanding selection by taking advantage of the longitudinal design of the data sets that we have. So one of the, actually from the Moving to Opportunity, another study using that data with collaborators, we've shown that health outcomes, well, health conditions, and especially child health, was very much related to the extent to which people were able to move, even when they were incentivized to move by this Moving to Opportunity study. Of course, using the LAHD allows us to get at issues of selection by taking advantage of the longitudinal, as I said, design. And then that was with the study that was published in Social Networks, we've shown that the level of violence in a particular neighborhood is significantly correlated with the formation or dissolution of inter-neighborhood commuting ties. And that was very, very interesting. One of the first studies that has shown how violence can impact the structure of connectivity across neighborhoods within a city. So the next question is, the extent does health also make an impact on inter-neighborhood connectivity and commuting, inter-neighborhood mobility? It's very much relevant for the issue of selection when it comes to neighborhood effects, but it's also a macro level question that I'm focusing. Oops, this is. I'm focusing right now. So, health problems make a difference for mobility, as I just mentioned. I won't belabor on that. We know that typically research on neighborhoods starting even a century ago has focused very much on sort of internal processes, the level of poverty, the level of job availability, the level of pollution within a neighborhood, to what extent that affects people's health outcomes. And unfortunately, this understanding neighborhoods in the context of their own connectivity hasn't been possible for a long time because we have not had access to data like the LAHD. More recently, in fact, there's actually a series of studies coming showing mobility across neighborhoods based on Twitter location data or based on Facebook location. There are all kinds of smartphone application and their location, but those are extremely limited. I'll go more perhaps in the Q&A into advantages and disadvantages of a data set and a project like the LHD compared to some of the cool studies coming out now on mobility, because I think that could be quite important in perhaps motivating the census people to stick to it, despite the challenges that you must have. So again, this is the example of Chicago, and the question is how disparities in infant health problems may be related to differences in mobility, connectivity among neighborhoods. This is also Chicago, where the nodes are representing these community areas here. We're looking at the commuting connectivity across Chicago neighborhoods for over 14 years, leading to a data set that has just from 77 nodes. These are just 77 nodes. But if you take into account all the ties across the neighborhoods, or all the possible ties across all the neighborhoods, it leads to a data set of 83,000 ties per year. The sources are LHD and LODES and connection to the vital records, and a ton of other data from the Chicago Data Portal and the decennial census. I can discuss more about how we decided on sort of defining commuting ties. Some of the analysis require binarization of the ties, and we had to make choices, and then we did some study of to what extent changing the cutoff or the boundary decisions made a difference for the results. And this particular study focused on a standardized index of infant health problems, like infant mortality rate, percent preterm births, babies born with low birth weight, babies born with very low birth weight. And then we controlled for variables at the residential area level as well as workplace area level, socioeconomic disadvantage, residential stability, diversity, population density. These are the standard confounders in research on neighborhood effects. And some of the newer contributions based related and facilitated by the LEG dataset are information on the full citywide network structure, such as the edge reciprocity, geometric degree. We also added information on the network of the public transportation, the spatial contiguity matrix, and then we controlled for the linear time trend and dyadic stability. So quickly thinking back to how neighborhoods are connected, these are the same Chicago areas that have high, many health problems in Chicago, and we're only highlighting here the connections between these communities. Bear in mind that communities that have a high degree of health problems and high disadvantage have typically been thought of as isolated. We've had very important and influential and useful theories for a long time about the social isolation to which poverty and disadvantage can contribute. And of course, in comparison with neighborhoods that are more healthy, these high health problems neighborhoods are less connected. Nevertheless, as you can see, there's red neighborhoods compared to the medium health problem neighborhoods and compared to the low health problems neighborhoods here. There's still a tremendous degree of connectivity. So given that, what does that mean for the neighborhood? We don't have a typical social isolation problem here, according to these graphs. Does this connectivity make any difference? More importantly, when you think about homophilous connections, perhaps it might be the case that these neighborhoods are not isolated totally, but maybe they're just connected to each other, right, as this graph may suggest. But if you look at the extent to which neighborhoods are connected across different categories of health levels, you see quite a good amount of connections across health categories as well. This is connections between low health and high health neighborhoods. And also it's highlighting how these connections will look as a function of where the cutoff for the ties is set, as 1% or 4%, for instance. So why does it matter? How does it matter to look at these neighborhoods and how they're connected to each other? This graph again is Chicago. The communities are colored based on their health problems. The darker areas have the higher health problems. And then the crosses here, the green crosses, are showing the larger they are, the more health problems they in the communities that are connected. So think of this polygon, for instance, here as residential neighborhood, and then the cross represents the health level of the communities that this particular community is connected with, which could be anywhere, like you've seen those ties before. Now, what this overall is showing is that the level of health in a community is very much correlated with the level of health in its own commuting network, as also demonstrated by this graph. This is the commuting network level of health, and this is the local level of health. So what can we do with this information? One of the powerful, really cool things about the LEHD is its longitudinal nature. Because we don't have a randomized design, of course, there's all the, the standard threats to causal inferences that we have to deal with. But the longitudinal component allows us to have a sense of the temporal order, to analyze the extent to which infant health problems of prior time periods impact the commuting structure or the inter-neighborhood commuting mobility later. And for that, we use a model that is called the temporal exponential random graph model. It sounds fancy, and it is really quite different than the standard regression model in the sense that it allows observations to be interdependent, and not only that, it really adjusts a way for the overall network structure effects that otherwise would create major endogeny biasing problems in the standard regression. It allows controlling a way for the relational effects and also this more standard nodal effects, both for the home community, their senders, as well as the work communities. And then adjusting that away, we see our main result is that infant health problems the similarity among two communities and their health problems is very much related to a lower likelihood that any two communities will be connected through these neighborhood commuting ties. Well, this is the bigger table that shows all the variables included. It has the exact same conclusion, but the point is that we see this dissimilarity effect. I don't know if you see my cursor, but you see both when you control for the minimum, we control for spatial proximity and public transportation, population density, and so forth. And this dissimilarity effect is stable and robust to all these additional controls. It's also important to note that the findings are robust controlling for births, teenage birth rates, and violence, and lots of other possible confounders. So in conclusion, the results in a nutshell are highlighting that the similarity in infant health problems between two neighborhoods lead to decreases in the odds of ties between two neighborhoods. So people coming, a person coming from, or a population group coming from a neighborhood that has already a high level of health problems will have a higher degree of challenges in either getting a new job or maintaining a job in a neighborhood that is much healthier. And in the paper that we're happy to share at the end of this, it's still under review, so we hope if you want to cite that you'd ask for permission, but we'll be happy to share this manuscript to where we elaborate more on the mechanisms as to that we suspect are behind this findings. But for now, we just want to put it out there. There's a lot of work to be done at the individual level to understand some of these mechanisms, but there's no doubt that this is a robust and clear effect. The broader findings, this is really not a project that's not just about infant health, but it's really in general more about neighborhood effects and expanding the scope and expanding the conceptualization of neighborhood exposures and neighborhood risk to incorporate the information of the residential, of the network of connectivity around a particular neighborhood in understanding both individual and community level exposures. So we also have seen that socioeconomic and demographic characteristics significantly more likely to contribute to connectivity. There's a lot of homophily going on at the ecological level. We have seen that a ton in individual level network projects and studies, but this is one of the few that is highlighting at the ecological structural level. So this is not just about health, but this homophily and lots of socioeconomic and other features of the neighborhoods. So we want to leave with some thoughts about the need to reconceptualize neighborhoods as part of a broader spatial and network context of routine activities. So obviously we love working with the commuting network because workplaces are just really, I spend so much time in my work community, and I derive so much social support and resources from the community where I go to work. So it seems obvious, especially for those of us who work. Perhaps it is a bit of a different conversation for people who are unemployed. However, given what we know about how families influence each other and how neighbors, residential neighbors, influence each other in obtaining jobs and obtaining resources and social support, if my coworkers don't affect my son directly, they will affect him through me, to the extent that I find out about opportunities for recreation or extracurricular activities, just to give an example. But with respect to health or health outcome, I can find out about a doctor that, through my work network, that would be important in my, say, pregnancy outcome, and that could make a whole difference. So a doctor they might not know about had I not been connecting to my work network. So it's important to realize that this is really an important, is a huge step that is now made possible by the LHD project, and advancing neighborhood effects and advancing our understanding of spatial spillovers into the broader concept of network spillovers. So there's obviously policy implications. I don't work with policy that much, but it's inevitably I think about what does this mean in terms of what we could do with these findings. So what's important is that that we can get out of these studies on these findings so far is that whatever intervention we may make at the individual level or at the one particular neighborhood level, these findings are highlighting the importance of paying attention to the broader context of the neighborhood, but also, and that, that makes it a bit of a harder problem. But on the other hand, it, turning the problem around, it also highlights the fact that whatever impact one can have on a particular neighborhood through any intervention, it really has the potential to spillovers into all these neighborhoods that are connected. So we know these place-based interventions like the Harlem Children's Studies, I think it's called, and others like the College Promise. So there's all kinds of interventions focused on developing a particular neighborhood or enabling it to develop in a way that impacts its residents. However, understanding how neighborhoods are related to each other in context makes us understand also that these benefits may spill over across the transportation network, across the commuting network, which may or may not depend on public transportation. So this particular approach enables refining existing thinking and transportation planning and housing policy above and beyond our thinking on neighborhood effects. And with that, I will, there's a ton more that we could be talking about, but I think we're out of time at this point, and I will say thank you to everyone for participating, and I'm happy to take questions. Arlene, could you?
Thank you so, yes, sorry. Thank you so much, Corina. So at this time, we are ready to take your questions. Please put them into the Q&A box and we will address them as they come in. We've had a few questions regarding the recording and the slides, which will be available at our census.gov/academy, which Greg has put in the chat. So at this time, there was one question, and Megan was able to answer that, but I'll just go ahead and read it to you. The question was definition or calculation of poverty or disadvantaged areas. Are these based on census definitions? And then Megan went ahead and answered a lot. Would you like to read that, Megan?
Sure, yeah, I just, so the study that we conducted used a scale of concentrated disadvantage in line with Sampson's prior work that he published in Science in 1997. We used a factor-weighted principal component analysis to create the disadvantage scale using measures from the census based on the percent of residents in the neighborhood that were living below the poverty line, the percent of residents receiving public assistance, the percent who are unemployed, and then the percent of female-headed families with children under 18.
Perfect. So I'm not really showing any more questions. Going once. Oh, there we go. Does your research take into account access to healthcare providers?
Yeah, I could take this. I think our research does not directly account for that right now. But the cool thing about thinking about connectivity of people to their work network is that in this country in particular, the health providers and insurance, health insurance, healthcare is very much related to employment. And knowing who is in your network can make a big difference. Knowing who's good in your network can make a big difference. And then the assumption behind some of these mechanisms that we've been talking, thinking through with regard to network effects and network spillovers. The assumption is that this commuting spillovers will be contributing to influences not just in health risk, but also in opportunities to learn about health providers that would be of relevance to health problems that can be contributing to, pregnancy outcomes or infant mortality outcomes. Does this help? So, of course, this is a really good question. I think really one of the important next steps for this research and this line of work is to really understand how much of these spillovers across the networks are about health or are about health risks or about health opportunities, are about social support, or really financial resources or resources access to healthier foods, right? It's possible that going to work in a particular place enables one to access a Whole Food store or grocery shopping, or opportunities for better nutrition, or even nutrition knowledge. We've had this at this moment where we're seeing a rise in studies looking at how health behavior is spread through one's network. Much of this work is based on online networks, but there's a lot of connection, and there's a ton of theoretical understanding as to how one's online and offline network will be important for accessing knowledge relevant for health outcomes, as well as such as that related to health providers, but also access to physical resources such as better food, healthier food.
Great. So a couple questions came into the chat. One of the questions was answered by Megan, which was, do you use ACS 5-year data for these variables? And of course, she answered, yes, we do, in addition to 2000 decennial census to merge with our early commuting data. So another question is, does your research incorporate qualitative methods to help elucidate possible mechanisms?
I can take this. We do not, and we are waiting for collaborators and researchers to take this on. If this has been convincing, this is really the crucial next step to get into the more qualitative individual level surveys. And there's a good amount of rapidly growing research now on activity-based studies. So I don't know if I haven't mentioned a lot of it right now yet, but in other presentations I do get into that in more detail. And it's not necessarily qualitative, but it has an individual level perspective, and it's looking at the extent to which people's daily mobility is impacting their outcomes. It's under the umbrella of activity space. So if you are a qualitative researcher, there's not a lot of qualitative research, but there's a ton of research and growing on activity spaces that you can build on with respect to measurement. And of course, we all have our own anecdotes. But if you're thinking about a future research agenda, this has a huge opportunity for contributing to knowledge going into this particular topic, I would say.
Okay. Another question is, hi, I work in the field of childhood lead prevention, or maybe it's lead prevention. I was curious if you had thoughts on how your research or inter-neighborhood effects / spills over certain environmental exposures. For example, could there be notable spillovers across interconnected neighborhoods where one has the exposure and one does not?
I would say that yes. Lead is a good example. You presumably would be drinking tons of water when you go to work, and if you're pregnant, that could affect your pregnancy outcome. For example, I'm going on a limb here, but we have seen a growing number of research on looking and understanding spatial spillovers of these environmental exposures. We know that, and there's also obviously the issue of the how's it called, the modifiable area unit in geography. If anybody has a geography background here, you would be very familiar with that, where there's the possibility of different effects on individuals from neighborhoods defined at different geographic scales. So, but regardless of that, if you think there's a particular neighborhood boundary that is a relevant neighborhood definition, you still would want to explore. And we have found in previous studies that environmental exposures matter across neighborhood boundaries. And of course they would. If we're talking about air pollution, air does not stop where the neighborhood boundary begins. And when it comes to breathing air and drinking water, maybe even eating the food in your work environment, workplace environment, they would be bound to be influential on your health. And it could be a direct effect, just like you could be impacted by COVID, you could be impacted by air pollution at work. But it also could be indirect effect, and indirect does not mean less important. Indirect can be extremely influential because we have known for a while that education, access to information matters for a person's behavior, health-related behavior. So to the extent that people at work are exposed to information and other people who have that health behavior, or have the false knowledge that masks don't make a difference, right? For COVID exposure, for instance, or you're exposed to someone at work who tells you how to filter your water, and it can make an impact for the health of your family and of your neighbors if you share that information with your neighbors. Hopefully this helps. There's a ton of work that needs to be done. Much of what I say is really based on sort of theoretical ideas and assumptions, and also based on hope that a lot of us and a lot of you in the audience may be inspired to study this in detail on your own, and in your own local environment too.
Okay, there's a couple more questions in the chat, in the Q&A. So this one is just a statement. It says, there are good researchers in Chicago. I am formerly of University of Illinois at Chicago. And then another question, it says, hello, I'm late to the meeting, but did the census already release ethnicity data? For example, have the people who checked Black been separately by ethnicity, like Nigerian, descendants of U.S. slavery, Jamaican, etc.? I apologize. This is not a question pertaining to this webinar, so we will try to get an answer for you somehow. All right.
I think this is a good question
that
is relevant for us. Yes. So one of the neat things about the LEHD is that it presents these commuting flows not just as aggregates across neighborhoods, but also disaggregated by age categories and some by income categories. There's some information about the racial groupings of workers and residents that was added, I think, in 2010. I may be wrong here, but we definitely have some more information on the racial composition of workers and residents with respect to their neighborhoods of work or residence. As far as I know, and I may be wrong, I hope I'm wrong, because I've been waiting for some of this disaggregation to be included also when it comes to the dyadic connections, the inter-neighborhood flows. That's not yet available as far as I know, but I hope I'm wrong, or I hope that that it'll become available at some point, because that could make a big difference. Megan, for instance, is looking at the importance of segregation on people's lives, and understanding segregation at the residential neighborhood has been the typical approach so far, but having a sense of how people are breaking out of segregated places through these commuting networks can be a huge progress for knowledge if LEHD could figure out a way to release this disaggregation safely. As I know, confidentiality and safety are big dimensions and decisions as to what gets released and how. But it's a good question, and it's very relevant for this particular data set as well.
Thanks, Corina. So I'm not showing any more questions in the Q&A. So I'm going to toss it over to my colleague, Tanja White, to close out our webinar. So take it away, Tanja.
Thank you, Arlene. Thank you, everyone, for joining us this afternoon. Corina, thank you so much for the fascinating presentation. In closing, do you have any final thoughts to share with the audience?
I couldn't hear you, Tanja.
Okay. I said thank you for your fascinating presentation. Do you have any thoughts in closing to share with the audience?
I just want to say none of this would be possible without the LHD project, and without the enormous efforts that the census is putting in collaborating with the state, with the states, and then keeping that collaboration going despite the challenges of the pandemic, the challenges, it's a huge enterprise. I can't even imagine, and I'm so grateful. There's hundreds of people probably involved in this, and this is on top of the decennial census project that you have, and on top of all the other things you're doing. So I want to say thank you. We are now, I think, at the verge of a big change and a big advancement in neighborhood effects research, and this would not be possible without LEHD. We do have these new data sets that are making a big splash in understanding COVID transmission across space. Data sets like Twitter location, like I mentioned earlier, Facebook location, based on smartphone applications and how they move across space together with their users. However, none of it comes even close to the comprehensibility and the longitudinal comparison possibilities that LHD and LED and LODES offer. So I want to say a big thank you, and also to encourage all the people in the audience to take up the opportunity to make use of it.
Thank you, Corina. This concludes today's webinar. The LED webinar series will continue again in April. Stay tuned for updated dates and times. Finally, an evaluation will be mailed to you following this webinar. We would appreciate it if you took the time to fill out the short survey so we know how to better serve you in the future. Hope everyone enjoys the rest of their day.